And I think that sort of is the burden that any ombudsman can face. So excellent work, yet minimal impact. So that's specifically when you're dealing with oversight in the realms of, for example, oversight of correctional authorities, but also oversight of law enforcement, oversight of the military, or oversight of national security, all of which have incredible authorities and powers over Canadian citizens. These agencies typically are much harder to change the culture and I think they have almost like a visceral allergy to external oversight. And it's exceptionally difficult to make them change their ways. The culture is fairly strong, and there's plenty of evidence that correction falls under that same sort of a situation.
If you could choose just one thing that you would like to see change, almost like I guess like a parting wish ahead of your retirement, what would you like to see? One thing.
Well, I did mention that it's frustrating to do excellent work, yet not seeing that work influence decision making. I think we are effective as an agency when my dedicated senior investigators go to the institution trying to resolve matters at the lowest level, typically trying to deal with wardens and trying to address individual complaints. So we're fairly good at that, and by and large, wardens across the country are responsive to our recommendations. When it comes to trying to do systemic work and trying to resolve matters such as how Indigenous prisoners, for example, are treated throughout the system, how those with mental illness or cognitive deficits are not receiving an appropriate level of care. When you look at how women, for example, in custody, many of which are, well, the half of them are Indigenous, and some of which are housed in very severe, harsh conditions of confinement and secure or maximum security units. It becomes excessively difficult for the service to be able to respond to that. I can add to the list how it continues to baffle me when we're looking at, for example, aging and dying prisoners in the Canadian system that could be actually released in the community very safely and have much more access to dignity by spending the last few days or few months of their lives in the community. So these are very frustrating issues that I've dealt with over the years, but the list is long because we did some work, for example, on sexual violence and coercion. This is now almost, I would say, 4 years old, and the service has done little, if nothing. The Department of Public Safety also has not fulfilled its commitment. We wanted something as basic as to do an anonymous survey to determine the prevalence of sexual violence and coercion in prison, and nothing's been done. So yes, so I leave with a fair amount of frustrations. And I got to tell you, I'm leaving about 2 years earlier than the end of my term. And if I would have been in a situation where the agency subject to my oversight would have been more responsive, maybe I would have sticked around for another 2 years. But I think it's time for me to, I'm satisfied with what I've accomplished. The end result is that despite the fact that we are not effective at addressing those systemic issues, by documenting them in excessively great and detailed ways, despite the fact that the service does not immediately accept our recommendation, the fact remains that lawyers and litigators around the country are picking up our reports and using those reports in individual cases, litigation, but also class action lawsuits, and eventually are getting the service to comply to when there is blatant human rights violation. So that's it's an indirect way of being sort of effective. I wish that there would be more willingness from the Minister of Public Safety to acknowledge that there's a problem. I wish there was more openness on the part of the Commissioner of Corrections to openly accept that there are some problems and that they need to be some step taken concretely to address those problems. But ultimately, if they dismiss and disregard our recommendations, it comes back to haunt them later through litigation. And many, I suspect that this report will be another one that will generate, unfortunately, lawsuits and class action lawsuits to ensure that the service meets its legal mandate.
Fraser Needham, APTN.
I want to ask you about the Indigenous section in the report, and you mentioned greater resources putting toward healing lodges as part of meeting mental health supports for Indigenous people that are in incarceration. But from my understanding, they've been, even the existing ones have been underutilized in the past, and there's been a real resistance within CSC of using them. Could you maybe outline that a bit of what the problem has been? Of they've been around for quite some time, but often they even the existing ones remain underutilized.
Yeah, so back in 2013, we issued a special report called Spirit Matters. We only, as an office in more than 50 years in existence, my office only issued 3 such special report to Parliament. And Spirit Matters was one of them. And it identified serious gap in providing Indigenous prisoners with the services and programming they need. And we made it quite clear that we saw that, discovered that in the early 2000s, the service abandoned its effort to create new Section 81 healing lodges to be run by Indigenous communities, and reinvested all the resources and whether human resources or financial resources to correctional programs that were going to be delivered inside penitentiaries. So we did a follow-up to that report, which is now 2 years old, if I'm correct. And so in 2023, and we found the exact same situation. So right now, only about 2% of Indigenous prisoners are held in Section 81 healing lodges. The vacancy has, there's a little bit more occupancies in some of those healing lodges. But to date, we haven't seen, the service hasn't come up with concrete increases in in healing lodge beds or new agreements. We're told that they're working on it, but 2 years later, we still haven't seen any, despite that mandate letters issued from the Minister of Public Safety to the Commissioner made it quite clear that this should be a priority. We also are disappointed that 4 healing lodges operated by Correctional Service of Canada, which are far better resources than the Section 81 ones, have not been turned over to Indigenous communities or Indigenous organization. We made it clear that the service should do a request for interest and see if there are Indigenous organizations that would like to take over those healing lodges, consistent with the original plan, which was that those healing lodges were to be turned over to Indigenous communities. So it's a very disappointing that the service isn't reallocating huge part of its budget to do what's right and what is more effective down the road for Indigenous people so that their needs are better met.
Since this your last press conference, I have the same. There, of course, have been a lot of negatives in terms of Indigenous overrepresentation and incarceration. It's well known. But where maybe in your time as the investigator, have you seen some positive changes, I guess, with the way corrections deals with this issue? And maybe where do you see the primary area of all the ones they have to address that you'd maybe like to see addressed sooner than later?
Yeah, you know, when I first started with the Office of the Correctional Investigator 20 years ago, I guess the overrepresentation in federal corrections was hovering around 15%. It is now, as you know, 33% of prisoners in the federal system are from an Indigenous background. For women, the situation has even gone far worse, and they now represent about 50% of all federally sentenced women. You know, I do agree, you know, with the service saying that, you know, they're not accountable and they have no control over who is being sent to penitentiaries. But what I can tell you is that they have many leverages to affect correctional outcomes. And that's where they have been failing miserably. So that means that Indigenous prisoners that are serving time in Canadian penitentiaries are more likely to be classified as maximum security prisoners. They're more likely to serve a greater proportion of their sentence in custody than non-Indigenous people. They're more likely to attempt suicide, self-harm, to be transferred involuntarily outside their communities. They're more likely to be subject to use of force, to be placed in these SIUs, which is those structured intervention units, which is the former regime of administrative segregation. They're more likely to have their parole revoked or suspended, and they're far more likely to recidivate because they haven't received the kind of support and services while incarcerated and upon parole. So that hasn't changed. You asked me, are they positive factors out there? You know, I remain hopeful. That's part of my personality. I think it was good that the service after many, many years of advocacy for our recommendations to have a person on the executive committee dedicated to Indigenous affairs. So the appointment of a competent person there was a victory. But I still think the proof hasn't yet been demonstrated that that person was provided with sufficient authority and empowerment to effect changes. And those changes, in my view, can only come if the service is serious on reallocating its existing funding. The service is a fairly, when compared to other jurisdictions, has a fairly large budget. Is probably one of the best, well-resourced correctional authorities anywhere around the world. And if there are ways that they can actually deliver on better outcomes, that means to let go part of its budget to empower those Indigenous communities and Indigenous organizations to provide services, then they should. But it's a tough one. It requires a lot of leadership and support from our political masters to make an organization let go of its resources.
Mylène Crête, La Presse.
Oui, merci.
Parler là, que des places là, qui sont réservées à l'Institut Philippe Pinel à Montréal, je pense que vous le nommez comme peut-être une pratique à adopter ailleurs. Qu'est-ce qui bloque pour qu'il y ait davantage de places comme ça pour des soins psychiatriques?
Oui, alors, je peux vous dire que l'accord avec Pinel, pour nous, ça a été quelque chose qui a toujours eu une valeur supérieure au niveau des soins et de la qualité des soins de santé offerts aux détenus qui sont sous juridiction fédérale, qui ont été transférés à Pinel. Et pour nous, c'est une meilleure pratique. Si vous regardez la réponse du service à notre recommandation, justement, d'utiliser ce 1,3 milliard de dollars pour remplacer le Centre régional de traitement en Atlantique, le montant est faramineux. Et pour nous, le service nous a toujours dit que c'est très difficile d'entrer dans de ce genre d'entente-là, que les hôpitaux à travers le pays ne sont pas intéressés à prendre des prisonniers qui ont des problèmes sérieux problèmes de santé mentale. Mais historiquement, nous savons très bien que le service approche ces hôpitaux avec des conditions de partenariat qui ne sont pas adéquates et qui ne sont pas appropriées. Nous avons vu ça certainement avec l'hôpital royal d'Ottawa à Brockville, où le service ne voulait pas financer un nombre de lits spécifiques et aussi parce qu'il voulait simplement avoir plus de flexibilité à envoyer les gens quand ils en ont besoin, à des taux aussi qui étaient nettement inférieurs au coût réel d'administrer les soins de santé dans le système provincial. Alors, c'est clair pour nous que le service n'a pas été à la hauteur quand est venu le temps de négocier avec ces hôpitaux psychiatriques communautaires. Et ça, c'est vrai à travers le pays. 1,3
its partners, and that's true across the country. So if I were to take the $1.3 billion and divide it by 5, it would mean that for 150 inmates, if you divide it by 5, that would be 30 inmates per regional treatment center. I'm sure that the Correctional Service of Canada, for example, did not approach these hospitals and say, would you be prepared to enter into a partnership with us? We would like to transfer you 30 patients, and we have a budget of $250 million. I don't think that that is how the consultation went. As I told you, the Philippe Pinel Institute receives about $7 million per year for 20 inmates. If the Correctional Service of Canada had truly wanted to enter into a real partnership and fund it adequately, there is much more than a regional budget available to do so. So in my opinion, the negotiations carried out by the Correctional Service of Canada were ineffectual because in a true partnership, you have to engage with the psychiatric hospital and say to that hospital, we want you to devote a full-time team and we want to fund X number of beds for you that will be funded every year over a 5 to 10 year period. In that way, everything is clear. But as far as we are aware, that type of negotiation never took place. It has been quite some time that I have been working at the Correctional Investigator's Office, but I still remember when the Philippe Pinel Institute agreement was renewed, and it was a very difficult negotiation because the Correctional Service did not want to pay the appropriate amount for Pinel. And they even said that they would be able to administer the care themselves, which goes against the international human rights principles because correctional services should not be responsible. Should not be responsible for healthcare services to ensure independence. When you spoke in English, you used some very difficult terms. You talked about a system that is not made to care for mental health issues. You talked about people who have serious mental health issues. So is a major cultural shift needed? Can you talk more about what would be required? I can talk to you about security in regional treatment centers, for example. When we compare the way that RTCs are managed by the Correctional Service and then the principles that underline their operations and compare that to the Philippe Pinel Institute or other community psychiatric hospitals, it's like black and white. If you look at regional treatment centers during the day, during the week, between 8 a.m. and 4 p.m., yes, there is an appropriate number of healthcare providers. However, even during those hours, security plays a very important role or is prioritized most often. So after a certain hour, so that means every evening and on weekends, everyone who's working as a healthcare provider goes home, and these regional treatment centers most often have 1 or 2 nurses who work the night shift as well as weekends. So the basic model and the first response is usually almost always a security-based approach. If you compare that to the hospital in Brockville, security plays a very background type of role. The first responders are all mental health care providers. They are the ones who will respond. And they also determine if there is a security need, then they will contact someone to come in and deal with the security issue to maintain that relationship between the patient and the healthcare provider. So those two approaches are completely different. And all psychiatrists hired by the service that we interviewed wholeheartedly agree with our assessment that regional treatment centers are penitentiaries with some psychiatric services, but fundamentally they are not psychiatric hospitals to the same level that is available at the community level. Thank you. Now, Jim Brownskill from the Canadian Press.
Good morning. You touched on this in your answer to Mylene's question, but the correctional service seems to be saying on mental health, in response to your recommendations, that a couple things, that their facilities and services are up to standard, that they're acceptable levels of service in the area of mental health care. And secondly, when they do approach institutions outside the correctional service, there's reluctance or even inability of external hospitals and institutions to accept prisoners for care, and that they've rejected the overtures of the correctional service. So they're trying to work out arrangements, but it's difficult. What do you say to those two things?
I think our experience has been that when the services approach those various psychiatric hospitals and want to enter into partnership with them, they do so with conditions that make the partnership impossible to happen. We saw this years ago, for example, with the Royal Ottawa Hospital, when Senator Runciman, for example, was very keen to try to set up a partnership in Brockville with the service involved and the province of Ontario involved. But the service would not be willing to buy an appropriate number of beds that they would finance on a yearly basis, like they do in Philippe Pinel. And so they wanted simply as need basis. And finally, the agreement that ended up being struck was only for 2 beds, and that fell apart fairly quickly. Psychiatric Forensic Hospital wants, if it's going to take patients, like 20 patients or 30 patients, they want to be able to hire permanently a team, a multidisciplinary team of forensic psychiatrists, psychiatric nurses, criminologists, social workers, behavioral scientists, for example, to develop the expertise and the requirement. And under those conditions, there are lots of hospitals that would agree to this. amount of money, for example, with respect to Pinel, is a $7 million a year for 20 patients, for 20 beds. When we talk about $1.3 billion, I can tell you that the service has not approached those hospitals and say, I have 30 patients. It's probably less than 30 patients because a lot of those RTCs, about 30% of those beds are not even meeting the criteria for admission to a forensic facility. They are basically aging and infirm individuals requiring medical care but not forensic care. I can tell you that if they would have approached those hospitals and say, hey, I've got 30 individuals that are acutely mentally ill, require some care, and I'm sitting on, $250 million. Would you like to partner with me? I think the response would have been, absolutely, we'd like to at least engage with you and see whether we can find a middle ground. So that's the reality. And I can tell you that if there was, a proper public consultation or even hearing about this, and you would bring those hospitals to testify, they would have probably agree that the service conditions for a partnership were far below what is required, and that the service is attempting to hog the money and are self-serving, self-serving and self-centered when it comes to entering into healthy partnerships.
If the correctional service is not providing the level of mental health care that's required, what does this mean, given that many of these individuals will be released someday? What does it mean for broader Canadian society and for these individuals once they are released?
Well, one of our, the sixth part of our investigation looked exactly at that, discharge planning. So what happens to those who are mentally ill and are about to be released in the community? To which level do they get appropriate services? And what we found is the service has, over the years, shrunk significantly its funding envelope to support those individuals. And about only 6% of them are receiving some sort of more structured release. What we found time and again is that even on basic things, to make sure that the person who is released has health card isn't happening in almost 50% of the time. So how do you make sure that those who are mentally ill and the proportion is excessively high, but the criteria to receive the services in the community is so narrow that it only touches a minimum amount of persons. So the net effect is that people are being released often without ID, without making the connections with the healthcare system, the provincial healthcare system. There are no provisions for housing, for example, which we know is critical to reduce reoffending. So that overall the service is doing a poor job at ensuring safe release of those who are mentally ill. So reaching, providing services to only about 6% of those who are in need is grossly inefficient and has, unfortunately, public safety consequences.
We'll take a very last question. Monsieur Zinger, il nous reste 8 minutes. Alors,
We have 8 minutes remaining. So if you could be concise in your responses, please. Peter for CBC.
I wanted to ask the minister's response to
Microphone, please.
the hospital recommendation that you make in there. I don't see it in the report, but did you address it? Did I miss that earlier?
The initial, yeah,
Like
so.
the second recommendation in your report?
Yeah, so Correctional Service of Canada basically discussed only two options about the replacement of Shepardy, which is inside the walls of Dorchester penitentiaries. And I agree that that place, it was built in 1880. It's completely inappropriate. It's not a therapeutic environment. It needs to be replaced. But they only consulted at the time on whether it would be appropriate to renovate it or to build a standalone facility inside the walls of Dorchester. At the time, the minister was Dominique Leblanc, was Minister of Public Safety, and the announcement was made around 2018. So it's already been quite a while. And what was initially supposed to be a 400 million then ballooned to 1.3 million. And they're continuing to pursue that. And we saw it in the newest budget that they continue to allocate that amount for that. The option of securing MOUs with the provinces to provide and transfer people is something that my office has advocated for years, but others as well. There's even right now in the Senate a bill that makes the case for such a transfer. It is in the law and has not even been considered.
So have you gotten a response from Gary S. Sangre about this, like that you mentioned here, that you haven't from the time of publication? Did they come back to you and say no, or was it the budgets keeping that figure in, that was the only communication you did get?
No, so the current Minister of Public Safety has responded to our recommendation. That's available on Public Safety website, and it basically rejects the recommendations. So my recommendations were in two: is to recognize that those RTCs are nothing more than intermediate care facilities and should be recognized as such, because that's the level of care they're providing. And my second recommendations was directed to the Minister of Public Safety, saying that he should reconsider that $1.3 billion because of that it fails in so many ways to be consistent with international law, but also to meet the needs of those who are severely or acutely mentally ill in the system, or those who suffer from suicide ideation or chronic self-harm.
merci. Ça conclut cette
Thank you. This concludes our press conference, and we wish you a good retirement. Thank you for your service.